how COVID-19 has impacted deployment of digital health. Some areas were amplified, some areas were chilled. In the back of all that, anybody who was already struggling with technology was hurt by this massive and radical change. Those who had already implemented, started, had their employees already organized around it were much more likely to successfully pivot.
Joint replacement surgeon and digital health guru Dr. Stefano Bini has been busy throughout the COVID-19 period. His organization DOCSF has held virtual summits with healthcare and economic thought leaders from around the world to discuss leading trends that have surfaced from the pandemic. In our conversation with Dr. Bini, he highlights the burgeoning focus on digital health and data collection from a hospital and industry standpoint.
How will COVID-19, do you think, impact the digital disruption?
So let's just take 2 seconds to define digital health in a very simplistic way, and many people may disagree with me on this, but it's important to understand what we're talking about. So when I talk about digital health, I talk about the way we deliver care, not the care we deliver. So something like digital therapeutics, the idea of using, for example, artificial intelligence to go through a bunch of molecules, identify which ones are the most likely to be appropriate for a specific drug, doing clinical testing and improving a clinical outcome, that's the care we deliver. And there's definitely an element of digital, a part of digital, or the technologies that are part of digital, like AI, that fit that bucket. What I'm talking about now is digital orthopedics or digital health as the way we deliver care, how we provide that care to our patients. In the traditional world, it's through clinics and hospitals, and in digital, it's how can we deliver that care virtually, and how can we optimize the systems in the background. So how can we use AI plus RFID tags to track patient motion through a hospital to optimize the resource allocation within that hospital? How do you use a platform that can improve or take your consults coming into your system and reach out to patients through text messages to minimize all the work that has to be done to contact people, et cetera, and optimize that process. So those are all digital health tools, okay? So within that world of the way we deliver care, obviously, probably the biggest beneficiary in our space was telehealth and telemedicine, all the virtual care platforms. And I have a number of friends who run companies in that space because, of course, of the work that I do in tech. And I remember speaking to one who said, look, it took me usually 4 or 5 years to get 7 to 10 healthcare systems signed up. And in the past 2 weeks, we've signed up 70. So there's been a massive demand on the healthcare system side for technology that will enable them and support their ability to care for their patients virtually. So telehealth is no longer this backwater. Across the country, the numbers was around 1 to 2% in the world, actually most healthcare systems of care being delivered virtually. Some areas, Alaska was a very early pioneer in this space, a little bit ahead of that. But for the rest of the country, it wasn't a big part of the care we deliver. And part of that reason wasn't the technology wasn't available, but the methods, or I should say the support systems weren't there to support it. By that, I mean payment models, rules and regulations. You couldn't see your first visit on telehealth. You had to have established patient experience. You couldn't practice across state lines. There are so many blocks to the ability to deliver care virtually that it hadn't really grown. Obviously, COVID-19, CMS and others, also some of the insurers were supportive of opening these platforms. A lot of those regulations weren't necessarily changed, but they were put on hold, allowing us to test this technology. So telehealth, now within our world of, there's very few clinicians that haven't at least tried it, found it wasn't all that bad, and that for certain types of things, it's really terrific. For example, follow-up visits of people who are doing just fine after their surgery. people with a check for their hypertension, for example, they don't need to drive across the state to come see a specialist. They can do so from the convenience of home. So both on the patient side and the clinician side, there was this forced discovery of this technology and the finding that actually works quite well for a subset of the care. So just to give you a sense of what that mean by that, UCSF was doing something like 10,000 visits a day. We went to doing 5,000 visits a day, but of those, almost 90% were virtual at one point. We're now down to about 50 to 60. Our numbers are going up, so the total number of visits is still very, very high. Our patient satisfaction is very strong. But in some specialties like orthopedics, it's dropping. We're not, some people, especially like ours that requires examinations, isn't as likely to maintain such a high percentage of telehealth visits that than say primary care, where maybe the well patient follow-up visit can be done virtually. So you're going to see some variation in adoption, but that's sort of the tip of the iceberg. We've also got a lot of other platforms that are in that virtual care space, such as patient engagement platforms. These are platforms that are designed to manage patients virtually through a Q&A kind of process with the software. The app has a series of questions that are sent out over a specific time to manage patients during a recovery process, for example, postoperatively. That can be used to manage patients at home virtually by asking questions and triggering response at a time when we know patients have those questions. Very successful, very helpful. Another big area in my specialty of orthopedics has been the use of virtual physical therapy. What you're saying in virtual PT is the ability to engage with a physical therapist either live or through avatars or through simple checklists that gives you these exercises you do at home with or without supervision from a real person. And behind that, there's also been a boon in technology around sensors that you apply to your body that collect some information that gets sent back to the therapist. This could be a range of motion, could be step count, could be gait type. So those are the technologies that are building around us. So that's the telehealth space in a word that's going on. But it's had a chilling effect on other elements of of digital health. For example, robotics or anything that requires a large investment of capital up front right now is on hold because all these hospital systems, as we had discussed, are controlling or holding back some of their data sets. Sorry, some of their financial insights. Another one is AI for virtual scribes and the whole digital scribe thing that had to pivot to be able to scribe from, say, a video visit as opposed to an in-person visit. But those technologies are coming around. So, if you look at this summary, this picture, this question is how has COVID-19 impacted digital health? If you're paying attention, you're noticing that the healthcare systems that were most resilient in their ability to manage COVID-19 were the ones that had already invested in digital technologies and were able to quickly pivot to their use. So those that had not found themselves scrambling and realizing that implementation of technology is tricky. You don't just turn around one day and say, oh my gosh, we're behind. We need to get these 6 platforms online. Because cybersecurity is a big deal, and it takes a fair amount of work to get your EHR and everybody else and all the systems vetted to meet the cybersecurity standards. APIs are not that easy to link. They make it sound easy, but actually to link to Epic or Cerner is a fairly decent amount of work. And then once you deploy the technology doesn't deploy itself. You need to socialize it. There's a great article in the Harvard Business Review showing that companies that deploy technology successfully spend 50% of the budget for that technology on HR issues, literally teaching people how to use it, holding their hands in the process, making sure they understand the technology. It's not just about deploying tech. You've got to make sure that the people changing from analog to digital are assisted in that process. It is not true that just because you own a smartphone, you know how to deploy tech.
These are many of the trends that we've tracked as well, and certainly look forward to seeing how they progress as the recovery takes place. What advice do you have for industry on how they should be thinking about digital health and data collection today?
I think that, again, if we learn anything from COVID-19 is that those who really have invested in digital technology and infrastructure are the ones that are more likely to weather the storm and be able to support their clients effectively. It's not just COVID. There's going to be floods, there's going to be earthquakes, there's going to be wars, there's going to impact infrastructure. I think a lot of the weaknesses that have been pointed out by this particular pandemic were around supply chain. And I think I think most companies that are looking at how to manage a next event are looking also closely at how to strengthen the supply chain to have multiple points of access and also have a better understanding of what their supply is. I think a lot of the large companies, including, maybe even especially large companies that have legacy systems, don't have a particularly strong supply chain management systems, especially inventory management systems. And I think that anybody that's making an investment in understanding how to move their inventory around, especially if they can't produce more inventory and have to rely on what they currently have, are going to fare better than those that don't make that investment, because these events are going to continue to happen. It may not be another COVID. It may not be maybe something similar. Another important concept has to do with understanding the importance of accessing and supporting some of these digital health tools, especially around data collection, like you pointed out. So where we're going on the supply side is probably the ability to have a better sense of what is going to be needed in a prospective fashion. So investing in artificial intelligence technology that is in the concept of predictive analytics in terms of the predicting supply is going to be quite helpful. I am pretty confident about that, because if you're getting into a situation where now you got x-rays that can be read by a machine and templated automatically, why can't we let the industry know ahead of time what is available? And what I would encourage industry to do is not necessarily to wait for their clients to adopt these technologies, but to partner with the software companies to make that available at a lower cost, because the healthcare systems right now are very shy of making investments, but they know they need the technology as well. And so there's a way to support that. Another just much bigger, higher level concept is that there is an opportunity to start leveraging digital technologies internally. And I don't see a ton of companies doing that. I think they're looking at digital technology as something they sell or promote externally, but don't necessarily adopt internally. And that mindset's going to be a problem. It's hard to sell something you don't understand, and you got to walk the walk, right? So at some level, what I'm seeing, and it's not just an industry, it's healthcare as well, and I might get in trouble for saying this at some level, but what I'm seeing is senior leaders who don't understand technology are afraid of adopting it for being perhaps called out as not understanding it. And that's a problem, because that means that people junior to them, younger than them, who do understand it, don't have the ability to promote it internally. And so the appeal is, hey, if you don't get this stuff, that's fine. No one's going to hold you accountable to it. There's tons of digital analog stuff. This still has to happen. That requires the kind of experience that senior managers have, but they need to understand that a lot of the problems they're facing in an analog world that could be very expensive to solve, that require a lot of man hours, could just as easily be managed very easily with a technology solution, and that somebody should be enabled internally to deploy and seek out the solutions, deploy them, test them out, and if necessary, and if it's proven to be successful, to implement them. And not have that sort of fear of not understanding it and sticking to what you know, because at some point you're going to get left behind.
That's really good advice. I appreciate it. Is there anything else that you would add?
No, I just hope I get a chance to do this again with you guys and speak to your team. I was really looking forward to it. It's a real opportunity to bridge the gap between the two different groups looking at the same problem, but from different perspectives. Yep. And it's something that we try to do at DOCSF, is to bring everybody's voices to the table so that we can all share and understand each other's concerns. And so one of the things that it's hard to do on the virtual platform is ask the questions, hey, what are your concerns, and how can the clinical side, the clinicians and the providers support your needs? I think we're all in this together. I think the opportunity to move the ball forward is something that we share. There's no competition here. It's a brave new world. It's like the Wild West. There's costs associated with it. How do we share them? How do we support each other and minimize those? How do we learn from each other in the process so that at the end we can deliver the best care possible, the lowest possible cost, the highest quality outcomes? I think we're all in this together, and from that perspective. And the more we communicate, the more we share information, the more we convene together and share our needs and find common purpose, I think the better off our patients will be.